You co-authored Day to Day Living with Dementia. What does that book cover and who is the book for?
The book is really for anybody who wants to know a little bit about dementia, but I would say I targeted it most first and foremost toward family caregivers, who I think are perhaps one of the most underappreciated, under-resourced group of individuals, right? I've heard this term that dementia caregivers are also often called the invisible second patients. And I think that has to do with the day-to-day stress that they incur that often goes unrecognized. So this book was to give them a landing spot, something that's easy to digest, maybe first and foremost to tell them that they're not alone, but also to have them recognize that in even amongst the difficulty and the challenges that they will incur undoubtedly, that there is a path forward and a path forward which allows them to be in a situation that they did not ask for, but in a way that does not derail their own well-being along the way.
You are going to be speaking in Cedar Rapids Monday morning. What message are you hoping to bring to people in Eastern Iowa during this community conversation on Alzheimer's disease?
I think for those people that are living with dementia, I want this message to be that life can be hope-filled, and that a diagnosis does not define an individual, and that they are more than their medical condition. I want them to understand that hope is not something that we either have or don't have, but instead, hope is a cognitive behavioral process. In other words, it is really shaped through our attitudes and our actions. I want them to hear what people living with this disease previously have done to make sure that their life is as meaningful and as joy-filled as possible, and to have them recognize that that is indeed the case in terms of what can happen. And also because I know family caregivers are going to be there, and family caregivers are near and dear to my heart. I am one myself, caring for family members, two of them right now who have dementia. I want them to feel heard. I want them to feel seen, and I want them to walk away knowing two or three things that I think can absolutely make a difference in how they journey forward.
Mayo Clinic dementia expert Angela Lundy. Angela, thank you so much for taking the time to speak with me.
Thank you, Danielle.